Well, it is 9 a.m. This is Talk of the Town for Friday, March 20th, 2020. And a very special episode of Talk of the Town on the air today, as we will be dealing with the COVID-19 healthcare crisis going on. Not just in our world, not just in our country, our state, but really we're addressing it here in our community as well. So we'll start with Vicki Bird from Logansport Memorial Hospital. Good morning.
Good morning. How are you?
Doing okay. It's good to have you guys. And,
Thank you.
And this is we keep using the word unprecedented, but that's really what it is, isn't it?
It is. It is.
I mean, these are really bizarre times and kind of stressful times, and
Yes.
a lot of fear and anxiety out there.
Yes. Yeah.
And so we're doing this today to kind of address some of that and get some
We
facts
want to make
out
sure
there.
that the community is educated
Right.
with the facts. So
Okay.
that's why we've assembled a team of experts here
Right.
to share information. So I'm going to introduce everyone, and then we'll turn it over to them. We have Dr. Dory Diddy, who is the health officer of the Cass County Department of Health. Serenity Alter, who is the administrator of the Cass County Department of Health. Tara McVeigh, who is our chief nursing officer at the hospital. And then Sheila Briner, who is our infection preventionist at the hospital as well.
Okay.
So they will be sharing what we have done, what we kind of are planning to do in the next couple days or so, and then just facts about COVID-19 in general.
Okay.
Okay.
All right. So Serenity, we'll start with you as far as where we are with this from the county's perspective. Oh, we starting with the doctor?
It doesn't matter.
All right, we'll start with Dr. Diddy. My bad. We'll start with Dr. Diddy. So let's start from the ground up. Why is this such a big deal?
Well, of course, anytime you're dealing with infection like this that has the potential of pandemic, the more we can make the public aware of what they should do to keep themselves safe as well as others, that is a key factor in all of this. Again, kind of reiterating about COVID-19, I'm sure everybody is familiar with the main symptoms that we are monitoring at this time of concern would be fever, cough, difficulty breathing, very similar to common flu symptoms. And basically it's impossible to tell the difference without testing.
Right.
And we are starting to test more and more individuals that have those type of symptoms. To date, so far, we have tested over 150 patients in Cass County.
Wow.
And so far, we have no confirmed positive results.
Okay.
And just to make people aware, testing is done through two modes here in Indiana right now. There's testing that's going through the State Department and testing that's going through private lab, which is primarily how the testing is going at the hospital. If you get tested, it's sent to a private lab.
Okay.
And then those results, of course, any positive results will be posted through the state, but negative results are not necessarily calculated in the state's data. So just because you haven't seen any positive results in Cass County doesn't mean we haven't been testing so far.
Right.
But again, basically here today to kind of give people some information about symptoms to watch for and what they need to do and when they need to be medically evaluated.
Now, while we're on the subject of testing, though, we had a story this morning that there is an at-home test that will be available on Monday.
Probably still the best test routes are to go through either the state or the private labs.
Okay.
I can't verify how accurate the
Right.
home testing is at this point.
Okay. What does the test consist of when you get tested?
When you get tested at the hospital, you'll basically get a nasal swab is what we're doing primarily.
Okay.
And most people will generally be tested for flu as well because we want to make sure that we're not dealing with a flu syndrome before proceeding to the COVID testing. So most people will get flu tested in addition to the COVID tested.
Okay. Sheila, you're going to say something.
Yes, as far as the actual home test,
Yeah.
I do a lot of education with staff about how to properly swab for patients. It is very uncomfortable.
Yes.
So I would be concerned about how accurately somebody at home could do that test.
Okay, see, that's good information to have. That's absolutely good information to have.
Yeah, they may not be collecting the specimen appropriately, and then that in turn could produce false negatives.
Okay. So what specifically about this COVID-19, what is making this so dangerous?
Well, the danger of it, of course, is the main group of patients that you would be concerned about, of course, would be anybody who is elderly or otherwise immune compromised. People that have what we call comorbidities or other medical conditions that might make them more susceptible to complications of flu. People with respiratory illnesses, chronic respiratory problems, heart conditions, people that have diseases that require them to take medications that mediate their immune system. These people can be more susceptible to complications from the virus. This is a population that we're trying to prevent as much exposure as possible.
Right. Now, is it exceptionally aggressive in these people?
Yes, and when they have these other medical conditions, their bodies, they just don't have the reserve to fight off that an otherwise healthy person would.
Okay. All right. And that's why it's so important. And that's why we're taking the steps we are.
Yeah.
Right? So the social isolation and social distancing, that's who we're trying to protect.
Correct.
Right?
When we talk about social distancing, we talk about flattening the curve.
Yeah, we've heard that a lot. So
Okay.
let's explain that.
Okay, so basically, the whole premise to flattening the curve means that we're going to stretch out the time from that all the population ends up with the infection. Okay? So the odds are that everyone's going to get it. It's just we want to be able to take the optimal care of everyone, and it's much easier to do if we only have, say, 10 patients versus 1,000 patients in the hospital. So the idea of social distancing and closing these different things, canceling big events, is to slow down the population that needs to come to the hospital.
Right. So is that what you? Because a lot of people say it's overkill, it's too much. We're blowing this way out of proportion, and we're really not, are we?
I don't think so.
Right.
I would like to see all the elderly people and other people that get it, that come to the hospital, get the very best care, and that's always easier when we have the less number of patients.
Mm-hmm. Absolutely. How easy is this? I guess how easy is it to contract it? I mean, how contagious is this?
It's similar to flu.
Yeah.
I mean, if you're around somebody that has it and you're exposed to what we call respiratory droplets, someone coughs, someone sneezes, these little droplets float through the air and they get on someone else or they inhale them. There are viruses in those droplets that then start to reproduce in the new host. So it's similar to a cold virus, a flu virus.
So while we're on that, what I've heard a lot, people compare it to the flu, as far as and they compare the numbers, and there far more people get the flu than this. Why are we and so, but that's a dangerous thing to compare, right? I mean that really shouldn't be compared. The two shouldn't be compared.
Yeah, I mean the flu is its own process as well, and certainly has its own concerns, which is, why we've been worried about flu year after year. But it's also something that has been more prevalent. This is, of course, the first time we're dealing with this and seeing the ramifications of the infection from COVID-19 and how it can impact the same types of patient populations that are susceptible to problems with the flu.
Mm-hmm.
But it's a new virus. It's a rapid spread. All of these things are coming into play with this. Watching what happened in China and Italy and trying to do what we can to prevent those kind of issues here in the States now.
Now, what about the origins of this virus? Because it had its origins in animals, right?
Well, they were speculating, yes, it came from animals. But now that, of course, the main concern is person-to-person transmission.
Mm-hmm.
I believe they're not clear on how it transferred from what animal,
Right.
etc.
Right.
But I mean, as a side note, the coronavirus, there's multiple coronaviruses.
Yes.
And so a lot of them came from some animal.
Right.
And we have them all the time. They're called the common cold.
Okay. And those come from.
Different. It's sort of like a family. So the coronavirus is like a family,
All right.
and each family member has its own name.
Okay.
So the common cold is a type of coronavirus. This COVID-19 is a different family member.
Okay.
Similar to how you have influenza A, influenza B.
Okay.
They're all influenza. They're
Right.
just a little bit different strains. The viruses are just a little bit different.
Okay.
And that's what she's getting at with corona. There's lots of coronavirus, but then COVID-19 is a subtype of a coronavirus.
Okay. Because one of the things that was thrown out was that we don't have a natural defense against this. That our human bodies don't have a natural built-up immunity to this at all. And that's the case, right?
Yes, because it's new.
Okay. And that's what
It's
makes
mutated.
It's mutated, yeah,
Yes.
and that's what's kind of made this such a big deal, right?
Mhm.
Right. All right. So this is something that's a big deal, and this is something that is obviously impacting a lot of areas around here. I know Howard County has confirmed cases. We do not, but certainly around Indianapolis, the numbers go up. Obviously, with the population increase, you're going to see that. But this is something that we got to be ready for and be careful about, right?
Mm-hmm.
Yeah.
Absolutely.
Yeah. And the best ways of doing that are kind of what we've been doing with washing of the hands and staying away and touching the face. Yeah, that's always. Why touching the face? What is that?
Because at the end of the day, when the droplets that Dr. Diddy was talking about, when they touch you or you touch them on your hands, then you touch your face, they go a lot of times through your nose or your mouth or your eyes, and that's how it gets in your system.
Okay. All right. So, how long does it take to display symptoms of this?
It's 2 to 14 days is
2
what
to
the
14
CDC
days?
is saying.
Okay. And so that's why the 2 weeks is kind of what we keep hearing, right?
Yes.
All right. Good deal. All right. Well, hey, we're going to take a quick break. We will have more coming up as we discuss the COVID-19 healthcare address right here on Talk of the Town on WSAL. It is 9:17. This is Talk of the Town for Friday, the 20th day of March. Very special edition of Talk of the Town as we are addressing the COVID-19 crisis going on around the area in our community, and I guess let's take that next step and talk about Logansport Memorial Hospital. They are kind of, the who we're going to turn to in this in this time as far as where we go next, and let's talk to Tara McVeigh with Logansport Memorial Hospital. And so 150 tests so far, and so far so good. But but you guys are preparing for this.
Yes. We've been working for several months really looking at this, tracking what's going on in other countries, talking with the health department, making sure that we're looking at getting prepared. Really over the last couple weeks, we've been engaged more so in really changing some of our processes within the hospital and working with the health department. We've done a evaluation of all our supplies, looking at what we have to protect patients, protect our staff, make sure that we have the right PPE. Some of the things that we've been looking at is personal protective equipment, is
Okay, thank you.
PPE. So looking at utilizing masks, goggles, gloves, even looking at rooms that we would put some of these patients in that are called negative pressure rooms, just for a change in the air with the outside versus the inside of the hospital. So we have purchased additional what they call HEPA filters to help improve the utilization of some of our rooms with that. We participated in state and national calls in addition with the health department. We've developed the COVID-19 task force at the hospital in conjunction with, we've implemented incident command center, which that just means we have certain people in charge of certain things at the hospital, which would be supplies, managing hospital rooms, managing the flow of patients. We identified an off-site center really to move some patients to look at evaluating signs and symptoms of people with the COVID-19, which are looking at if they have an elevated temperature, if they have a cough, if they're experiencing some shortness of breath, to really truly focus on managing those patients and providing the care that they need at that time. We've also changed our entrances as well.
Okay.
So we only have during the day 3 entrances open. We have our main entrance open from 6:30 to 5. We have the MOB entrance open, which is the entrance to the cancer center, the women's health area, that building over there. And that's open from 7 to 5 as well for those patients. And then the emergency room department is the only door that's open 24/7.
Okay.
So if you do come through the night, the only door you can get in is the ER entrance.
Now, there are restrictions on just visiting too, right?
Yes, yes, and as you're coming in, we do have a questionnaire. We're asking everybody certain questions related to their risk of having the COVID-19 disease or infection.
Right.
And we are also taking everybody's temperature on their way in. We're giving them a sticker as well, whether they're a patient or visitor, and where they need to go, and logging their temperatures too. So we are obviously, if somebody comes with an emergent need into the ER, we would mask the patient, take them into the ER, that type of thing if they needed that care. But we are limiting visitors to 1 visitor as well for our inpatient floor and that type of thing, just to minimize, as we're talking about social distancing, as we're talking about groups of people getting together. The more people we have gather in a facility, the more likely you are to be at risk for things. So we're trying to minimize those things the best we can. But our goal really is to take care of our patients. Our goal is to do the best care that we can with our patients, because we still have other illnesses going on.
Right.
Still in conjunction with this, risk of infection.
Sure.
So we're really looking at how do we best provide all the care we need to take care of other issues people have in conjunction with minimizing the risk of getting the COVID-19.
Now, how soon did you guys jump into action when this whole thing started getting?
We started, I don't know the date off the top, it would have been the Friday before last Friday. We shut down all the entrances. So Friday night at 5,
okay.
we went to just the 1 entrance, so we could start managing and monitoring people. So
that was your first
it would have
step,
been,
yes.
really 2 weeks ago today.
Wow, okay.
Yes, so.
Wow, that's quick.
Yeah, so we started doing that so that we could really try to monitor who was coming in the building and protect our other patients and protect our staff. We
Sure.
wanted, before, patients came in contact with our staff, to know the risk. So because we need to keep people available to help take care of our patients and things like that, and we want to protect them.
Absolutely, because there's a lot of businesses are having people work from home, and there's some things you just can't. You have to go and
Right.
be at the building.
Right.
That is certainly one of them. All right, so what's next? Where do you guys where do you go from here?
Some of the next things that we're looking at is we continue to evaluate any restrictions or monitoring at the door. As things have been changing over the last couple of weeks with recommendations, we continually look at those recommendations, and we need to adjust and make changes based on that. We're also looking, one of the biggest things we really worked on is alternative health care models. So we're trying to get some telehealth implemented, so we can do some visits by different alternatives to take care of patients, but the patients can be in their home using modern technology and have visits with our physicians with that. So we've really worked really hard this week to try to get that up and going. We piloted a couple patients with that with a couple doctors, and our goal is to get that rolled out so that we can keep people at home but still manage their care.
Right.
So.
Right. Now, how has the reception been to this from either the patients or people coming in? Is everybody understanding
for the most part, yes. We've had people thank us.
Sure.
Thank you for helping take care of us. Thank you for doing this. So it's been overall very, very good. The reception of people and the engagement of staff and helping, and people's jobs are kind of morphing and changing, and we're asking people to do different things. And sometimes I'm just like, here, this is the best I have for education, and we're going to work on doing this and going forward. And people are great about jumping in and helping. Everybody's really been very good at.
Well, that speaks to the culture there, that it's all about protecting patients and doing the best thing, right? Yeah,
Yes.
absolutely. All right, so anything else what the hospital is up to with this?
One of the other kind of main things that we started earlier this week, then we evaluated at the end of last week, we have restricted elective surgeries, which is the recommendation from the CDC, from the governor. He started that last week. So we started looking at guidelines, and now basically we're really, not all elective surgeries are truly elective surgeries. So there are some things that we're doing for people that if it's going to change their outcome in the next 4 weeks, if we don't do this surgery, something related to a cancer diagnosis, something related to other, significant changes in the health of the individual, we are still doing some of those surgeries, but truly elective surgeries that's not going to change the overall health care of the person the next 4 to 8 weeks, we have eliminated those types of surgeries. So, and again, it's to preserve our equipment, and it's to minimize the risk of the patients and the staff.
And I'm sure those are not easy decisions to make.
No, they're not
I mean,
at times,
you
right?
know.
So, but for this, it's really looking at down the hall, and we're not canceling these surgeries. We're just
We're
postponing
just postponing them.
So it's not that it's not going to happen. It's just not going to happen right now.
Right.
So our message is that we want to take care of you. We want to help with your health care going forward. But this is just not the best time to do it. So let's postpone it going forward.
And I guess that's a good point, because I think what needs to be reiterated through all of this is that there's light at the end of this tunnel.
Mm-hmm.
Like we're going to get through this. We're going to get past this. But right now we have to take steps and take measures that aren't comfortable, that may be a little bit, I don't know, it may make your day a little hard, but it's for the greater good, right?
Yes. And physician staff has been great about really looking at these and communicating to patients and looking at the best care for those patients.
Right.
So they've done a great job.
And then on top of that, you have all the other things that a hospital has to do too, right?
Right.
Yeah.
Right. So, yeah. So we're working through it. We're taking the recommendations from the CDC, taking the recommendations from the local health department, and we've worked very closely with them so that we're all sending
Right.
the same message and so that we're caring for our population of people.
And that's very important, is to be on the same page across the board, right?
Yes.
Yeah, because that's there's a lot of misinformation and a lot of opinion being circulated.
Yes.
Yeah, and so it is huge that we're all on the same page and having the same information out there.
Yep.
All right, good deal. Tara, thank you very much. Tara McVeigh from Logansport Memorial Hospital. She is the Chief Nursing Officer at Logansport Memorial Hospital. We'll take a quick break. We will have more coming up. It's Talk of the Town on a Friday on WSAL. And this is Talk of the Town on WSAL. Good morning to you. We're discussing the COVID-19 crisis happening in our world today, and we're dealing with it on more of a local level today. Serenity Alter from the Cass County Health Department up next. Good morning.
Good morning.
It's good to have you.
Thank you.
All right, so let's talk about the county and the city and what their response is so far.
So at this time, we've been in communication with ISDH frequently. They have updates at least daily, so we can follow the CDC guidelines and recommendations. And at this time, we're asking all restaurants to do no dine-in, and they do drive-up and carry-out only. And we've seen that everybody's complied with that, and some of them have even closed on their own, which we really appreciated.
Right.
We do go around and check those, and everybody's been really good with that. We're asking that all organizations, churches and everything, that they do a gathering of no more than 10, and everybody's really complied with that. We've been really happy with everything. We did close the Y and the workout centers at this time, so non-essential business, we ask that that's done. The city building has closed to public at this time. The Cass County Health Department has closed to public, so we can kind of focus on this. And that's been really good. We still, if you have if you need a death or birth certificate, we ask that you do that online,
Okay.
or that you email that to us, or that you do it by mail at this point. If it's essential that you have to have it for like a driver's license because they're doing the real ID, if you can just call us ahead of time, we'll make sure we take care of that. That's fine.
Okay.
The funeral homes have just been calling ahead, and we've delivered them to them. Funeral homes now have been doing go ahead.
No, I was going to ask about funeral homes, because
It's been a big thing.
that has to
That's
go
been a
on,
big
and
thing.
funerals have to happen. And so how is that going to work?
A lot of them have just been doing no visitations.
Okay.
Just kind of immediate family only, or by actually invitation only. I mean, but
Right.
yeah,
Right.
a lot of them have just been doing like immediate family, or they've been sending a visitation or an invitation. They've even done a lot of them how they do it online.
Yeah.
So we've seen a lot of that.
Right.
So, but we've not really had any complaints about it at all. So
Good.
everything's been going well with that. We've done supplies to the nursing homes and everything. We've had, if anybody is short on supplies, I ask that you just give us a call. They are getting ready to give us a stock supply, so I ask anybody give us a call if you're short on masks. We have had a big problem with surgical masks.
Yeah, that's been nationwide. We've had issues with that, and really, it's only good if you have it, right? If you have the virus, that's when it's effective. It's not really effective from getting it, right?
You mean the mask?
Yeah.
That's what I was saying.
Yeah.
Okay, so,
Yeah. Swing that over.
sorry.
Yeah.
The mask, they're asking that you wear the mask only if you're sick
Okay.
and have to go somewhere.
Okay.
Now, the hospital, if you're coming for an appointment to your doctor or you're going to Express Med, they will give you a mask if you have respiratory symptoms when you
Right.
come in the door.
Right. But there's no need to stock up and hoard them either. Right?
No,
Which
please
is
don't do that.
right. Don't do that, and don't get the desk mask from like The carpenter's
The
use. Those are
N95s, yeah.
absolutely useless against any of this stuff, right?
Well, we're recommending that just for first,
Right.
like, not right now, we don't even, just like for firsthand frontline people.
Yeah, yeah. I'm just talking like the like a woodworker would use, like that dust mask.
Not at this point.
Those aren't even.
Yeah.
All right. So far, people are being compliant with all this, and businesses are.
Yeah, we haven't had any issues so far.
And that's one thing we've tried to do at the radio station here, are still promote some of these places that even though you can't go in and sit, you can still get this food to go. You can still enjoy it.
Absolutely.
You can still
And we-
patronize these businesses during this time.
And we've noticed a lot of people that usually don't do carry out have adapted and they're doing carry out. So
Yeah. Right, and that's that's one of the that's one of the things as this hits, we're seeing it more and more. It affects so many different aspects and so many different facets of our everyday life. This is just
Absolutely.
it's incredible, isn't it?
absolutely.
It really is. All right, so what else is the county doing with this?
Well, right now we're on a yellow advisory.
Right.
And then, I mean, as things change, obviously, that'll change as well. So we have no confirmed cases right now, so as things change, they'll kind of change that accordingly.
Right.
And then the county building right now is not essential only as well. So we ask that you call ahead and if something can be done over the phone, that's what they want to happen right now. I'm not sure what's gonna happen, as they'll change it, that'll be up to the commissioners. They are limiting their gatherings as well.
Right.
So commissioners' meetings and everything right now are 10 and under, so it's really not really public as of right now.
Okay. So let me ask one of you guys. What's the number 10? Why is that kind of the magic number with this?
That's just the recommendation.
Is
as
that
of-
just the recommendation? I mean, I didn't know if that was a specific thing or just why 10 specifically. You know?
I don't really know if there was a specific reason for the 10, but it's just gonna decrease your risk. I mean, the less people you have together, the ability to have more space between you.
Right.
And depending on the size of the room.
Yeah.
That was what the CDC identified as a safer group of people to minimize your risk.
Because
So
it
that's
started
what we
out at
adapted.
like 250 and then down to 50 and then down to 10. And so that's just what it is. So just to be safe. All right. So Serenity, as far as the county goes, we're under the yellow travel advisory. So do you have any idea what that means? Can you explain that a little bit further?
That's just use caution. It's pretty much the same as it is with weather. We've just adapted it to this. So it just use caution right now. We ask that we're really just kind of encouraging everybody to stay home as much as
Right.
possible.
Right.
If you have something that you need, go out and get it, but just kind of stay home and use caution.
Okay. So that's kind of where we're at that.
Mhm.
But if we get a confirmed case, then we'll readdress it.
We'll readdress it.
Right. Okay. Gotcha. All right. Anything else from the county that you want to address? Because I know you guys have had your hands full, and I know you've been very busy with this.
If you have any questions, feel free to call the health department,
And that's
753-7760.
okay. And that's important to have those open lines of communication and have
Absolutely.
the right information out there. Right.
Absolutely. Yeah, one thing I ask that before you put anything on Facebook, social media, please call and get the facts first. Because
Yeah.
we've all been kind of trying to fix that.
That's an uphill battle, man. I mean, telling
It
you,
is, it really is.
It's there's so much that it's so easy just to reshare, repost, and if you have something in your mind and you have something that fits, then you're going to share it, and it could be completely wrong,
Absolutely.
and that's really dangerous right now.
And we're all open. I mean, we've closed our health department to the public, but we're all open there for phone calls. So if you have any questions, please call.
Right. Have you had people calling and asking?
Absolutely.
Yeah. So what are you hearing from people?
Just everybody. Actually, a lot of the questions are how many are getting tested, because we've had from nobody getting tested at all in Cass County, and we just want people to know, we are doing testing. And then, as far as we've just had everything, symptoms. If 80% of the people are going to have mild symptoms,
Right.
and we just want it's. I'll let Dr. Diddy address that one.
What's that?
But go ahead.
One of the things on Facebook, people are asking about the use of ibuprofen.
Okay.
So I'm gonna let Dr. Diddy address that myth.
All right.
There's been a lot of discussion on whether or not we should be using ibuprofen because of the anti-inflammatory effect. Is that good or bad? Is that something we need to be considering? Right now, we don't have any studies that prove that use of ibuprofen is detrimental with COVID-19. But again, they're continuing to look at this, and that's the whole thing with COVID-19 right now. Again, this is new, this is fluid. The recommendations are changing daily. And that's why it's so important to know that the health department, the hospital, we are all working in close conjunction with our local officials, the state health department, the CDC, the national recommendations. But as of right now, we have no specific recommendation on whether to use or not use ibuprofen. I mean, certainly a good alternative would be Tylenol or acetaminophen as your primary fever reducer, body ache reliever. There, of course, are conditions where if you are unsure about dosing in regards to pediatrics, if you have other medical conditions that might be affected by ibuprofen use, such as kidney or liver disease, if you are unsure, again, do not hesitate to contact your primary provider who is familiar with your medical history, and they can make further recommendations on how to treat your symptoms at home. Again, the greatest thing that people can do is get plenty of rest and drink plenty of fluids, still going back to the basics. But yeah, anytime people have a medical question, feel free to don't hesitate to contact your provider to ask those things.
That's why they're there, right?
Yeah.
Yeah, absolutely. All right, good deal. All right, we'll take another quick break. We'll have more coming up on Talk of the Town on WSAL. Just about 9:45 at WSAL. This is a very special edition of Talk of the Town, and we're discussing the COVID-19 crisis happening right now. And one of the things that we wanted to address right now, presently, is if you think you may have some of these symptoms, or whatever, just you were saying, call before you come into any appointment, right?
Yes, and we're asking that you please call in to your primary care provider. Call in if you have a fever greater than 100.1 and it's combined with a cough. And this is a new cough that's different than anything that you've had or you may have on a regular basis, and it's in the last 14 days. Or if you have any difficulty breathing and it's changed in the last 14 days. We want you to call in, talk with your primary provider office, and they'll give you directions as what to do next.
So what happens then with the primary care provider? Do they make accommodations, or how do they deal with it?
They're going to direct you as to what they want you to do based on your signs and symptoms and your history, your medical history. So they'll talk with you, assess you over the phone, or evaluate you over the phone based on what you're reporting, and then they'll give you directions as to where they want you to be seen and how they want you to proceed.
All right, Jill.
So a lot of people they're going to advise them just to stay home and self-isolate. 80% of the population is just going to have mild symptoms.
Right.
So some of those treatments at home for the COVID is the same as what we do when we have the flu.
Right.
At my house, it's chicken noodle soup and Sprite. Okay.
Sure.
For you guys, it's fluids, it's eating right, it's getting rest. You can, of course, isolating. You can help reduce the fever with that Tylenol and or ibuprofen NSAIDs that Dr. Diddy was talking about. You can also use cool rags behind your neck, armpits, in your groin to help lower the fever as well. Okay, and then if it's critical, if you feel like you have an emergency, then obviously, you're going to get treatment.
Right. Okay, so that's why it's important to call before you come in, right? Call it. All right.
Yep.
All right, now let's go to Dr. Diddy and get some of these other, I don't know, where do you want to go next with this?
Well, one of the things that has been a hot topic right now as well is now that we've been isolating, when is it appropriate to end your isolation? And we're in a lot of discussion right now about how best to approach people that have been complying with recommendations to self-isolate, and how do they go about returning to work when necessary. Again, reminding this is fluid, this is changing daily, but again, right now we're in, with what Sheila was saying, with the majority of people having little to mild symptoms, we are appreciating people that are taking it upon themselves to stay home. There are certain criteria that we have for people that can return to work right now with essential jobs. If they have been ill recently, we want to make sure that part of the criteria to return is no fever for the 72 hours prior to their return, as well as symptom improvement, and also 7 days since the onset of the beginning of your symptoms. So we're trying, a lot of times right now when we are encouraging self-isolation, typically we're recommending isolation right now for at least 7 days.
Okay.
So the 72 hours has to be with no fever reducing medicine. So they can't be taking Tylenol to keep their fever down, or that doesn't qualify.
Okay. All right. So there's so much to this. I mean, there's so much to this, and it's. I'm glad you guys are here to talk about this and kind of walk us through this, because this is unlike anything we've seen. It really is, and I'm so glad you guys are here to help us through this and kind of talk about some of the facts and get us educated on what this is and where to go next. So I guess let me let's talk. I don't want to say the words worst case scenario, but let's say someone is diagnosed with it. What then?
Again, a lot of it's going to depend on their symptoms and their medical history.
Yeah.
Again, reminding people that the majority of these cases will be mild, but you are going to have people that have other medical issues that develop shortness of breath. Those are the people that need to be evaluated. Again, the whole thing that they alluded to earlier that Sheila was talking about, flattening the curve, it's not that we're trying to completely prevent coronavirus. What we're trying to prevent is the exponential development of new cases that overwhelms that medical industry's response to treating these people. Even through our hospital, there's certain things that we treat at our hospital. There's certain things that we have to send to larger facilities that have other capabilities. Even at those larger facilities, there's lots of limitations in what they describe as bed availability. That doesn't necessarily mean that there's not a physical bed to place these patients in. Oftentimes that means there's not enough staff to treat the amount of patients that we have. So what we're trying to do at this point is try to let this have a gradual increase versus an exponential increase where you're overwhelmed with the amount of patients that you have to deal with. And now there's rapid spread through the community, there's rapid spread through your political leaders of the community, your hospital personnel. If you knock out 30% of your hospital personnel locally, that makes it more difficult to treat the people who are coming in sick. Mm-hmm. So that is what we're trying to do with this. And our main take home right now is, if your symptoms are mild, if they're very flu-like, but you're not short of breath, you're drinking fluids, you're getting rest, these are the people that we ask to stay home and continue to self-isolate under the recommendations. It is the people that are having difficulty breathing, that we need to be getting in for assessment primarily. And again, a lot of this is going to be through phone triage with your primary provider. We've set up our primary COVID testing in the community right now out at the Express Med. We are still, seeing patients, for other things as well. And everybody needs to understand that the rest of medicine right now is still ongoing. This is just in addition to the things that we're normally dealing with on a daily basis.
All right. So, did you have something?
I just want to let you know that not everybody will be tested if they come out to ExpressMed. So I want to be clear that we are following CDC guidelines, and you can call in to ExpressMed as well before you come in, and they can talk with you over the phone. And then once you come in, you would be evaluated, and only certain people are being tested based on their symptoms and negative results of other testing as well. So.
Yeah. Again, it's not always necessary to know for sure yes or no. Do I have it? Don't I have it? Again, we have limited testing supplies, and as this increases, those are going to go quickly. And it's most important to know what we're dealing with the people that have the other medical issues, the people that are hospitalized, the people who have more critical symptoms. These are the ones we need to be aware of. But again, if you have mild symptoms that you're able to manage at home, it's not always necessary to know yes or no.
Dr. Diddy, with the results of the test, will it change the way the doctors are treating the patients?
No. Basically, right now, because there is no specific treatment or cure, treatment is what we call supportive, or is basically just treating symptoms like we do with the flu, like we do with the common cold. So just knowing yes or no right now doesn't necessarily impact that individual's treatment in any way. Again, this is why, though, we tell people that you need to self-isolate, because you never know when what you have is exposing someone else who may be more susceptible to the complications.
Well, we were talking about how fluid this situation is, and as we were talking here, Cass County is now under an orange travel status.
Yeah.
So we are now officially elevated from yellow to orange. So I believe that now means essential travel only, for sure, right?
Yes, that's correct.
All right, very good. Thank you so much, all of you, for being in here. Dr. Diddy, Serenity Alter, Sheila Briner, Tara McVeigh, thank you guys for educating us and for talking about this, and we just appreciate every effort that you guys are doing to help keep our community safe and healthy throughout this. So thank you very much.